At the end of the day, the insurance companies are interested in one very specific thing. They're interested in making money. If they have a group of consumers and by helping them be healthier, they can reduce their medical costs and increase their margin, they're doing that. They are incented to reduce medical costs by CMS. They want those amount of money that they're spending to falling medical costs. Good morning, insurance agents of the senior market. Welcome back to another episode of Near and Far. It is Friday, September 3rd. Happy Friday. Hope you're getting ready for a great weekend. But speaking of great, there was a really great discussion going on insurance forums this week, which you know we're big fans of, on the senior forum, specific to new benefits that they're seeing on 2022 Medicare Advantage plans. And this particular discussion really focused on some reimbursement style benefits and are they compliant? Like, do they make sense? Some examples of this would be, for example, the type of benefits we're talking about would be the United Healthcare new combination healthy food and OTC card. Another might be Aetna's got some plans in different parts of the country that have a utility reimbursement where people can use those funds to take care of their electric bill, for example. So a lot of the discussion went around, why does CMS allow these benefits? Like, this doesn't even make any sense. Like, how can, dental I can see, vision I can see, but we're paying people's electric bills now? Like, what's going on? So that was a lot of the talk, and wanted to get into a little bit around those benefits and why exactly they're allowed and why they make sense from CMS's perspective. So CMS adjusted their definition of allowable supplemental benefits probably about 2 years ago. And what we've got here is a graphic on that change, what the previous standard was and what the current standard is now. And I think a lot of these newer benefits really fall into item number 4. Specifically, the area that talks about reducing emergency and healthcare utilization. And that's pretty broad. Like, there's a lot of area in there that you can kind of play in terms of designing benefits, designing packages or elements of your product that really fit into that bucket. So let's talk about how some of these new benefits very specifically comply with that fourth element of the new guidance, and we'll talk about some examples. A really great item that I found was actually a study done by AHIP, America's Health Insurance Plan, a federal lobbyist group. Most of you hear the word AHIP and you're like, no, certification. But AHIP does some pretty good work as well, in addition to their very terrible certification class. But in a study that was published in May of 2021, we've got a link in the description. Go down below if you actually want to read the whole study. I think it's pretty good, maybe like 5-6 pages. It's a good read. But the study was titled The Social Determinants of Health and Medicare Advantage. So should be very pertinent to most of you guys that are watching today. But let's talk about 2 examples very specifically from that study and why it keys into this discussion around these supplementary benefits. So in one of the examples in the study, they talk about a housing program, and they don't give a ton of detail on it, but they talked about a housing program for individuals, and that ultimately this program, when combined with some other care management elements, reduced emergency room and inpatient visits, and at the same time, increased PCP visits and prescription drug adherence. That combination, less ER and inpatient, and more PCP and taking your prescription drugs, ended up saving on average $6,000 per year in medical costs to the insurance company. The second example in this study focused on meals. And there's a whole lot of health insurance plans across the country, both for 2021 and even more now for 2022, where we're seeing meal programs, either meal delivery, healthy food like that United Healthcare benefit, a whole sorts of stuff. But this meal delivery program that was utilized did a weekly delivery of 10 meals a week, specifically to dual eligibles on the special needs plan. And the cost savings over the course of a 12-month period of time was $9,000 per year in terms of what was the medical experience in the prior year, what was the medical experience in the year where they had the meal delivery. That's a huge deal. I mean, $9,000 a year savings. You extrapolate that over a number of thousands of dual special needs plan beneficiaries. That's really significant savings. Well, where do those savings come from? Again, fewer inpatient stays and as well, fewer skilled nursing facility admissions for those consumers really adds up. At the end of the day, the insurance companies are interested in one very specific thing. They're interested in making money. Just like, why do you sell Medicare Advantage plans? Why do you sell Medicare Supplement plans? You're not going to do it for free. I know that you won't do it for free because a lot of times when you have guaranteed issued consumers for MedSup, folks will call our office and say, where can I write this where I'll get paid? So the carriers, same thing. They are interested in making money. If they have a group of consumers and by helping them be healthier, they can reduce their medical costs and increase their margin, they're doing that. They are incented to reduce medical costs by CMS. They want those amount of money that they're spending to falling medical costs because that helps their bottom line. Something that we would all be interested in if we were running the insurance company. So these benefits, very specifically with certain populations on the plans, these new ancillary benefits like healthy food, OTC, transportation, the utility reimbursement, heck, even the therapy dogs, all of these items are starting to be proven to reduce medical costs, and that indeed makes both CMS and the insurance companies feel like they are absolutely worth it. So thank you for joining us this morning. I hope you have a great Labor Day weekend. We'll have a quick episode for you on Monday morning, September 6th at 7 a.m. I'm Bill. This has been Near and Far. Have a great weekend.